Why do doctors seem so disappointed when you refuse to have a student in the room during your appointment? 1. About 3 weeks ago, I was scheduled to get Nexplanon inserted into my arm. My doctor, a wonderful man who knows what he's doing, asked me if I would consent to having a student doing the surgery. I decided that it would probably be nice for the student to deal with me since I'm terrified of needles and knives. I accepted, and I haven't seen my doctor this relieved before. So here's what happened during the surgery. I walked into the student's office. Students get their own office at the place where I go for the checkups, and introduced myself. We started talking, and I explained that I am terrified of sharp objects like needles and knives. She asks if I want to see the Nexplanon syringe, since it doesn't look like a typical syringe. We talked about it, and I kept telling her that she was doing great during the surgery, since I thought it was appropriate. We later talked about her studies, and how it was to be a student doctor. She told me that she was grateful that I allowed her to be the one to perform the surgery since she had to perform a certain number of them before she was a proper doctor. So to answer your question, there aren't that many people who consent to having a student to their checkup or watch, which means that they don't get enough experience in the field as they should have had. 2. Thank you for asking this question. It gives me an opportunity to spout off about a view I hold dear. Personally, I've never known a doctor to show outward disappointment at such a refusal, but I can completely understand their potential inner disappointment. They're in charge of teaching young medical students. What's the best way to teach? Through hands-on experience. If every patient refused, then the doctor's hands would be tied. It's one thing to read about different types of lumps in a medical book, but no words in a book can match the experience of actually seeing or even feeling those lumps. Furthermore, yours might be the only opportunity that student will ever have to see or explore an unusual medical condition. That type of opportunity is gold dust in an educational context. Can it be awkward or embarrassing? Hell yes. Is it worth the embarrassment? Hell yes. You're helping a new generation of doctors learn their craft. I went for a breast exam at the hospital once. I'd been experiencing pain for months. In walks a male doctor, accompanied by an attractive male student who looked about 18. Big, innocent brown eyes, like Bambi. The doctor, of course, received my full permission for this boy to sit in. He quizzed the student about breast tissue and different types of pain, and then came exam time. The doctor examined my breasts, then very graciously asked if I'd be comfortable with the student having a go. Fill your boots, I said. Poor Bambi stood over me, extending his shaky hands, looking like a deer in headlights. Are you sure it's okay? He reconfirmed. Go for it, I replied. And there I was, flat on my back, whilst a boy awkwardly massaged my breasts and his older uncle watched. Good times. It would be rare for me to stand in the way of training of any sort where young people are concerned. It's the best way for them to learn, and awkwardness is a small price to pay for furthering someone's education.